As millions of Americans decide on New Year's resolutions, a large amount of them will have something to do with health and wellness. Dr. Jason Bill, an interventional gastroenterologist at OSF Healthcare, joins us now with a few tips. Welcome, doctor.
Thanks for having me. Appreciate it.
Of course, glad to have you here. Now, first off, for our audience who is not aware of what it is, you call it GI for short.
GI, yeah.
GI. What is gastroenterology?
That's just a study of, human digestion. So everything from the esophagus, stomach, small intestine, large intestine, pancreas, liver, we deal with all of that.
And what are some of the key procedures and techniques you use in this specialty?
So, GI in general, our basic procedures are simple upper endoscopies, meaning, we take a camera, we look into someone's stomach, we take biopsies, which means sample the tissue, and then obviously colonoscopies, which maybe everyone who's 45 and above dreads, but we do a lot of colonoscopies. But we also do more interventional procedures, which is my area that I enjoy, dealing with the pancreas, liver, and then this new endoscopic bariatrics is, for weight loss and wellness. So it's great.
Yeah. So getting to the New Year's resolutions, when people come to you with New Year's resolutions in regard to this specialty, what's some advice you give them for long-term success?
I mean, first off, I think people they're doing the right thing, right? They're trying to, overall improve their wellness. They're making resolutions. It's just a small step forward. That is the first step, to take that mental acceptance, and then, what to do with that is difficult at times. I think people struggle. There's a lot of information out there. There's fad diets. There's medications these days, and so, what path to go down can be very confusing. My advice for long-term success is just consistency, meaning talk to your friends, talk to your, healthcare providers, and just pick a way, whether that's diet, whether that's exercise, whether that's procedural. Just pick it, stick with it, go with it. Do whatever you're doing for months to weeks, and you will start to see, that benefit over time. The results will kind of speak for themselves. And
speaking of dieting, your team has come up with a new fitness program. Tell us about that.
Yeah, so, in conjunction with OSF Weight Management Center, we not only kind of take that lifestyle piece, the nutritional aspect, the exercise aspect. We have a lot of resources available for that. But we also have started offering an endoscopic bariatric program through OSF where we really offer two separate procedures. Again, these are procedures that we do with our flexible scopes, so they're non-surgical. A patient is still under sedation, so they're very comfortable. The first procedure would be called an endoscopic sleeve gastroplasty, and that's where we actually go into the stomach. We take someone who has never had any surgery on their stomach. We take a suturing device, which attaches to the tip of that scope, and we run 6 to 8 sutures. We tighten those sutures down, and we shrink someone's stomach down, and honestly gives that sensation of fullness and really causes robust weight loss for a lot of people. The second procedure that we also offer is called it's a revision, but a transoral outlet reduction. And these are patients who have had surgery, let's say 5, 10, 15, 20 years ago, and they started losing that sensation of satiety, meaning fullness. They gain weight. When we look with the scope, we can see that they're in anastomosis and their stomach is starting to stretch back out. And so we can actually narrow that back down with our tools.
This is actually pretty fascinating once you start to get into it and get past all the technical terms involved. But for anyone that's interested in learning more about endoscopic bariatrics, where can they do so?
Yeah, so just reach out to our office. OSF Gastroenterology. We also have the OSF Weight Management Center. Our office numbers, I think it's on the screen, 308-5900. Just ask for a consultation, say you're interested in weight loss procedures, and we'd be happy to see you.
Well, you know what, Dr. Bill, thank you so much. I'm happy that I was able to see you and learn as much as I did today. Stick around, Central Illinois, because after the break, we have hot takes and a final check of the forecast.